My name's Julie Major and I'm one of the primary care pharmacists working with NHS Forth Valley. We work within the general practices to support them with medication-related activities. What we do will vary slightly depending practice to practice. We might deal with acute medication requests, we might check discharges and clinic letters and update any records accordingly. We manage high-risk medications, we look into supply issues and arrange alternatives for patients. We look into longer-term or high-risk medications such as painkillers or medications that require additional monitoring. We work with the practice to help them to review their own processes around medication, things like supporting the introduction of serial prescribing within the practice. We work closely with our colleagues in community pharmacy. I myself am a prescriber, but some of my colleagues are not. This means that if I issue a prescription, I can sign that and give it directly to the patient. If somebody who isn't a prescriber issues the prescription, that will still need to go to a GP for signing before it can go out to the patient. And we deal with any medicines-related queries, including things like side effects, drug interactions, or medication in pregnancy or breastfeeding. Essentially, anything to do with medications can come to us. So what we don't do within the practice is we don't dispense medications, we don't hand out actual boxes of tablets to patients. We wouldn't routinely review medications that can be dealt with by the Pharmacy First service. To give you a couple of examples of the sort of things that we might deal with in practice, a patient calls into the triage line. They think they're having a side effect to their medication. This could be passed on to the pharmacist. The pharmacist in the practice would then review if this is a likely side effect or consider a suitable alternative. The main advantage to patients from our service is that we are the specialists in medicines. When we review patients, our focus is on their medication. We have more time to dedicate to their medication-related queries, to look into things in more detail through specialist reference sources. We're aiming to help to support patients in the most effective and safest use of their medicines.